Do no harm. The basic principle of the Hippocratic Oath, an oath of ethics taken by physicians who pledge to practice medicine by a set of standards. The oath has seen many changes through the centuries, but the idea persists. A sick patient expects a certain quality of treatment when seeking health care. A physician is obligated to provide such care that meets the common standards of practice. But sometimes, a physician does not. Dr. Christopher Duntsch has been the subject of numerous television shows and podcasts. His medical career has made him famous, although not for any contributions he's made to medicine. In fact, his nickname reveals the opposite: Dr. Death. The name instills menace and dread. What did Duntsch do to warrant such a horrible reputation? How did a system of checks and balances fail? More importantly, why did the system fail? Christopher Duntsch completed neurosurgery residency programs at the University of Tennessee Health Science Center in 2010. From there, he completed a spine fellowship program at the Simmons Murphy Clinic, also located in Tennessee. Allegations were made in his fourth year of residency that Duntsch had operated while under the influence of cocaine. He was ordered to complete an impaired physician's program before being allowed to return to work. When it was time to find full-time employment, his resume claimed he had 15 years of medical training. It also claimed that Duntsch graduated with a microbiology doctorate from St. Jude Children's Research Hospital. That sounded fine, except the hospital didn't offer that program at the time Duntsch was said to have attended. Despite these questionable circumstances, Dr. Christopher Duntsch successfully managed to get hired by a succession of medical centers. The Baylor Regional Medical Center in Texas hired Duntsch in 2011 as a minimally invasive spine surgeon. The salary was nice for a doctor who was just starting, $600,000 a year, with bonuses. It didn't take long for the other surgeons to discover that Duntsch's resume was indeed too good to be true. There began a succession of botched surgeries. The good doctor operated on the wrong side of one patient. Ligaments that shouldn't have been touched were removed. Major arteries were severed during one minor back operation. One unlucky patient bled to death. Another eventually died of complications brought on by Duntsch's botched surgery. Several patients suffered full or partial paralysis. Administration eventually told Duntsch that he would never operate at their facility again. Before they could terminate him, Duntsch resigned. If the Baylor Center had fired him, they would have been required to report Duntsch to the National Practitioner Data Bank. The NPDB contains information that prevents healthcare providers from moving state to state without disclosing past professional transgressions that may or may not have resulted in medical malpractice claims. Being listed in this database might have saved more lives. But then again, it might not. You'll soon see the prevailing theory why Dr. Death was allowed to continue practicing medicine. Resigning from the Baylor Center, Duntsch joined the Dallas Medical Center. He lasted 1 week. One patient died under his care and another was severely maimed. He wasn't reported to the NPDB because he had only temporary privileges. At that time, that circumstance meant hospitals were not required to report instances of negligence. It took 2 more hospital transfers before he was finally reported to the NPDB. By then, the trail of the injured and dead grew longer. Duntsch drilled into one patient's spinal cord, leaving the patient to suffer severe paralysis until he died in 2021. Duntsch left surgical equipment in one patient's body. There seemed to be no end in sight. By the time Duntsch performed his final surgery, resulting in the patient being left with only one vocal cord, the other being severed during the botched operation, as well as permanent damage to his esophagus and partial paralysis, the Texas State Medical Board began investigating the surgeon with a poor track record. In fact, they'd been investigating him for 10 months. Duntsch's medical license was revoked on December 6, 2013. Due to the tireless diligence and efforts of the Dallas County District Attorney's Office, Christopher Duntsch was eventually charged and convicted on one count of injury to an elderly person, which in Texas elicits a harsh sentence. Duntsch was sentenced to life in prison. He became the first doctor in the United States to be convicted on criminal charges in the course of practicing medicine. He'll be eligible for parole in 2045. He'll be 74 years old. In the end, Duntsch was accused of injuring 33 out of 38 patients in less than 2 years. We'll probably never know why Duntsch did what he did. Was he really incompetent, or did he act with malicious intent? However, we have a better idea how he was allowed to commit gross negligence. Sure, Duntsch not being reported to the NPDB worked in his favor, but he had something stronger on his side. A neurosurgeon can bring in millions of dollars in revenue for a hospital. The average amount is $2.4 million. According to one attorney associated with the case, it's a tradition for some hospitals to allow their troubled physicians to resign before they can be terminated. A fired doctor can potentially sue the hospital for wrongful termination. Let them leave of their own accord, and the matter is swept under the rug, and that doctor's next place of employment will be none the wiser. It's a cycle where some hospitals profit at the expense of their patients. Sometimes that expense is a life-changing injury. Sometimes, death. It's uncertain if Christopher Duntsch's trail of transgressions would have been stopped had he been reported to the NPDB and properly credentialed. Medical credentialing has been proven to reduce an organization's financial risk of malpractice. However, the power of money and the lure of profits are strong allies, often stronger than any oath of ethics.